and using sanitizer as a way of dealing with the COVID-19 outbreak. Let's discuss this aspect. We're joined by Dr. Miriam Sidibe, who is a hand washing and public health expert at the London School of Hygiene and Tropical Medicine at the Harvard Kennedy School. Dr. Sidibe, good evening, and thank you so much for your time. Now, you're one of the few people in the world that has specifically focused their career on public health, in particular hand washing with soap and its benefits. Why is it so important?
Thank you very much for having me here tonight. I think for me what's absolutely critical is that everybody should realize that the best line of defense that we have against coronavirus is actually hand washing with soap. Hand washing with soap is the most cost-effective health intervention. The public health tool that the soap has been created for us since 2800 before Christ still remains what is needed in order to remove the virus from our hands. I think globally we realize that people are not washing their hands, and the reason why people are not washing their hands is because they either deprioritize, they forget about it. So if we want people to wash their hands, we need to make sure that we create an enabling environment, we make it something desirable, and that we don't think that just because we tell them to wash their hands that they automatically will. I think that's absolutely critical to remember, that it's going to take more than just instructing people. It's going to take making hand washing facilities and soap available and visible so that you can disrupt in people's environment, so that people think that it is celebrated, it's socially acceptable, not to practice the social distancing, to not greet with hands, but also to wash their hands regularly, and that it is not a lack of respect, but it's a real line of defense. I think that's absolutely critical.
Sure, it's interesting because you talk about the use of soap in particular. Some of the panic buying that we've seen in South Africa has centered around the sanitizers and, any other products that perhaps contain alcohol, because they seem to be preferred as a means of completely killing whatever bacteria or virus may be on surfaces, or even that one may have come into contact with. Why is soap still the best way to go?
Soap is the number one line of defense, because actually what the soap does, it's the virus that we're dealing with is what's called an envelope virus, and it takes soaps to be able to remove it properly from the hands with the whole hand washing techniques that you need to make sure that you're washing at least for 20 seconds. You can sing happy birthday twice in your head if you want to remember that time. But doing a proper thorough hand washing with water and soap not only removes the viruses from the hands. Now with the sanitizer should be used when you're out of home and for example you cannot have access to a sink and running water and a bar of soap. But I think, and it should be a sanitizer that has at least 60% alcohol content. But it should be more of a backup than a first line of defense. I think that's really important to remind people of.
You talk about the fact that people globally, as part of your research, found simply weren't washing their hands. What are some of the other bad habits that we as the global population have just developed around hygiene and in particular hand washing?
I think it's just it's not been celebrated enough. I think you need more peer-to-peer watching. If people feel like they're being watched, they will practice more. If they feel like they're left to themselves, usually they will skip that moment. I think globally the data is only 1 out of 5 people will be washing their hands when they come out of the toilet. That is before any global pandemic and any scare that we've seen. So even with the scare of coronavirus, you will see people washing hands quite a lot immediately, because everybody knows that hand washing is a socially acceptable behavior. The problem is that it is then not normalized and transformed into a habit. And this is what we need to really work on, even as we're tackling the coronavirus, because we don't know how long this is going to be around us. So it has to be transformed into a habit and something that's going to last longer than just the crisis of prevention at the moment.
Some of the concerns that have been raised for a country like South Africa, and also I suppose it's an area which you've done much work in, is then improving this mechanism in terms of hand washing with soap in areas that don't have access, in particular to running water or even to clean and safe drinking water.
No, I think that's a very important part, and I think this is where I'm really calling for and I've just created a global coalition of business networks to accelerate local actions, and we've just launched the National Business Coalition, for example, in Kenya this week, which is putting together all the different businesses to do a compact on COVID-19, and I'm really urging South Africa to do the same. Because I think at this point in time, what we will need is a collective action where we are tackling as well as water, hand washing facilities, and making sure that that is available everywhere. And whilst, some of the soap manufacturers will be there and are doing some public service announcements and conversations, it will not be enough. And I think we need at this point a concerted collective action that will put together the private sector and make hand washing facilities, access to soap, access to water, finding ways to be able to reduce water bills or waive them for a bit, to make sure that the hand washing is actually practiced regularly. I think that becomes absolutely critical.
We've seen Rwanda put out washing basins throughout parts of the city, Kigali. In as far as some of the interventions that you're bringing to Kenya this week, how possible is it to get that done, again, in the midst of water shortages in some provinces, and there not having been a swift enough response to even that basic human need?
I think it's going to be a real struggle, especially in parts in South Africa where I've seen water shortages being a big issue. But I think we've seen things like tippy taps, for example, which are, locally made little taps. It actually takes very little water to be able to do hand washing with soap. And I think people need to remember that, and we need to find ways in which we create locally available hand washing facilities, even in homes, that you can do in order to be able to wash your hands. There is and find ways to be able to, make that a priority, because there will be no choice. And of course, maybe in some of these areas, that's where the sanitizers can become a bit more useful. But that becomes still an ability to create locally relevant solutions in partnerships with exactly what I'm thinking, the private sector and other people and the public sector as well. And find ways to be able to reach out with some of these hand washing facilities and ways to be able to do that. I think it will be critical that we reestablish a way and we show people, because you don't actually need so much water to wash your hands thoroughly.